Good evening, and on behalf of the League of Women Voters of Portland, I want to welcome you to our webinar tonight. My name is Audrey Zunkel-DeCourcy, and I'm the president of the Portland League. We are very excited to bring this program to you tonight about untangling city and county services, specifically around services for behavioral health, housing, and homelessness. These are issues you probably see all the time in the news. So this webinar is going to dive in deep to the long-term issues and solutions that will provide background for what we understand in the news. The League is dedicated to making democracy work. We believe that democracy functions best when voters are informed about issues and engaged in their communities. And that's why we present programs like this. After tonight, please tell your friends, colleagues, neighbors, and family to watch the video or listen to the podcast of this program. The recordings will be posted on our website, lwvpdx.org, next week. Our moderator tonight is League member Barbara Bird. Barbara coordinates our discussion units, where members meet every month to discuss the big issues facing our community. Well, last month in October, behavioral health and housing were the top concerns in those discussions, so tonight's panel is very timely. She will introduce each panelist, and I turn the program over to you, Barbara.
Thank you, Audrey, and hello, everyone. In this program tonight, we'll be taking a critical look at the overlapping city and county services that regularly rank as the most confusing and frustrating to Portlanders: homelessness, housing, and behavioral health. We look forward to learning more about how the cities and counties' approaches to these important challenges differ and how they work together. How is the Joint Office of Homeless Services funded, and how does it work? What's the practical impact of this dual system on those experiencing homelessness or mental health problems? What's the role of community-based provider organizations? And most importantly, is there an effective shared pathway to resolving the human crisis that has overtaken our community? You're going to hear tonight from an outstanding panel of leaders who will answer these questions, as well as those from the viewers in our live stream. We are deeply grateful to our panelists for joining us this evening to help us make sense of the troubling issues that confront us daily. Each of our panelists will speak for about 10 minutes, and then we'll open up for audience questions. We invite you to post questions in the Zoom chat at any time during the program. They'll be read and answered as time allows. If your question is for a particular speaker, please note that in the chat. Now I'd like to introduce our panelists in the order in which they'll speak. And first a note, Councillor Candace Avalos, who was originally scheduled to be with us tonight, is dealing with the aftermath of a traumatic house fire. The League of Women Voters of Portland sends warm regards to Councillor Avalos and thanks Councillor Jamie Dunphy, who will be filling in for her. Councillor Dunphy, who will speak first, represents East Portland's District 1. He is vice chair of the council's Homelessness and Housing Committee, working to develop comprehensive, proven solutions for communities most affected by housing instability and unaffordability. In his personal time, he's a member of the Friends of Rocky Butte, where he helps with trail maintenance and advocates for increased natural access in East Portland. Next up will be Anna Plum, who's the interim director of the Multnomah County Homeless Services Department. Anna has worked at Multnomah County for a decade. Prior to joining the Homeless Services Department as deputy director in 2023, she managed COVID-19 shelters, led a data analysis pilot showing how homelessness funds were spent, and was involved at a staff level in supporting the A Home for Everyone Coordinating Board, a regional board working to reduce homelessness in Multnomah County. Our third speaker will be Scott Kerman. Scott is the executive director of Blanchet House, a Portland nonprofit dedicated to serving individuals experiencing homelessness, hunger, and poverty. With a background in leadership, social justice advocacy, and trauma-informed care, he has been instrumental in advancing Blanchet House's mission of offering shelter, meals, and dignity to those in need. And finally, we will hear from John Karp Evans. John is the deputy director of the Peer Company, formerly Mental Health and Addiction Association of Oregon. He has more than a decade of experience strengthening behavioral health and peer support services across Oregon. He has led and developed programs supporting individuals navigating mental health challenges, substance use recovery, and reentry from incarceration. So those are our speakers. First up is Jamie Dunphy, Counselor Dunphy. Jamie will talk with us about the city's approach to homelessness and behavioral health. Counselor, we look forward to your remarks.
Well, thank you. And thank you for having me. I am a poor substitute for Counselor Avalos, but happy to give her the evening so that she can focus on the really scary situation going on with her house. As was introduced, I am Jamie Dunphy. I am one of three Portland City Councilors elected to represent East Portland, District 1, which is everything east of I-205. Um, and as was mentioned, I am the Vice Chair of the Homelessness and Housing Committee. Um, a little bit about me, just my background. I come from a long I've spent almost 20 years in public service here in mostly in East Portland. Whether I was working in the David Douglas School District as a behavioral specialist trying to prevent gang activity or crime, or working in politics. I spent 5 years working for U.S. Senator Jeff Merkley and another 5 years working for Portland City Commissioner Nick Fish. Two of arguably in my opinion, our best elected officials, but also two incredible housing champions. Commissioner Nick Fish actually was the creator of the Portland Housing Bureau and really drove home a lot of brought an institutional lens to how the city of Portland is supposed to be responding to the need for affordable housing that the market is simply not providing. And U.S. Senator Jeff Merkley, also a huge housing advocate at both on the state level and the federal level. Um, as an elected official now, it's my job to take over and start retaking the leadership responsibility that the city of Portland is supposed to have with regard to building and facilitating affordable housing in the Portland area. The Housing and Homelessness Committee was one of the first committees that got established. One of the clearest and most obvious committees to address the most pertinent need on the streets right now. Ask any Portlander, the issue today is homelessness and housing. Um, as a committee, and as a government, we're finding our footing. This is always going to be messy. It's a new form of government, and there aren't a lot of guides along the way on how we're supposed to be running things. So we've been finding our way this first year, and anyone has seen it's been a little messy, but it's supposed to be. That's how these things work, and it's actually a beautiful thing. And the system we're building right now is so much better equipped to be able to be responsive to the real needs of our community in ways that the old form of government simply never was. One of the first actions that the Homelessness and Housing Committee took on is an effort that Councillor Avalos and I championed, and it is the Unified Housing Strategy. People ask me all the time, what is the city's plan for housing? And the reality is we have hundreds of plans. In fact, one of the things that the city of Portland does best is we plan. We get groups of really involved, really smart, really thoughtful neighbors into a room, and we say, what do you want to see out of your community? Whether it's in a new parks district or a economic development. And all throughout all these plans, we also ask, what do you sort of see? And over again, for decades, we hear we want more affordable housing. We want better housing. We want resources for our neighbors who are on the streets. And the reality is that for decades, we've taken that information, we've formatted it, we've put it into beautiful PDF presentations that live on someone's desktop and they're never looked at again. The Unified Housing Strategy, which was unanimously passed by City Council, is basically instructing all these city bureaus to go through their plans and say, what have we already asked? What have we already set as goals? What are our intentions? And what have we already asked the community what they want to see? And let's put it into one place. Let's align it so that we know every step of the way from someone sleeping rough outside until all the way through to a family buying their first starter home. And every step in between on the housing continuum. Where are our plans overlapping? Where are they contradicting? And where are there gaps? This is the first real step that the city has had to be able to comprehensively have a strategy, a single unified strategy around housing, so that when people say, what is the city's strategy? We can point to this new beautiful PDF that hopefully will not just sit on somebody's desktop for the next 10 years. It is intended to be an action-oriented document because the reality is we have an enormous need We have market forces that are far more powerful than any tool the city of Portland has right now. And we are running out of, we don't currently have any housing bond dollars to build new housing like we have been for the last few years. That could change. We may, there are plenty of conversations about what the future need for the region is, as well as the conversations at different levels of government, which is a lot of what we're talking about, whether the city or the county or metro or the state or the feds are the ones that move forward with these plans. Another enormous task that the Housing and Homelessness Committee has been trying to take on is to address exactly what we're talking about tonight, the relationship between the city and the county, and who is on first and what is their responsibility. Traditionally, the city of Portland has been responsible for the built environment. We're the bricks and sticks. We issue permits. We build housing. We manage parks. We manage the roads. We manage the police. We don't deliver health services. We don't deliver housing services. We are not the ones who historically operate homeless shelters or provide job training programs. That is traditionally the role of the county. However, those lines have been blurred over the years, partially because of urgency, partially because of ego, partially because of elected officials. And again, see back to the thing about ego. Previous city councils faced situations that were demanding. They were getting thousands of phone calls from the neighbors saying, "What are you doing about homelessness?" And it's never a satisfying answer to say, "That's not my job. That's the county's job. You got to go yell at somebody else." And so a lot of systems were built that are duplicative, that are expensive, and that are not the things that the city of Portland is best at doing. And we're in a spot now where I understand the rationale for all of that. I understand the urgency. I understand the crisis that we are facing. But it has led to a situation that is not serving our neighbors on our streets very well. And so I'm excited to be part of this conversation tonight because we need to understand what we do well and only do that. And we need to lean on our partners to deliver on the things that are their jobs and that they do well. And it's unreasonable for us as a city to imagine that any of this will work if we're consistently duplicating these systems. So, the Housing and Homelessness Committee, we've been inviting the staff from the county to come and present to us every other week about what is going on with the joint office. It's not called the joint office anymore, but the Department of Housing Services and with the Supportive Housing Services Committee. We want to make sure that information is shared freely and that it's informing each other's next steps. And I hope that we will get to a place where the city gets back into our lane and the county is able to take full control over these services. But for the foreseeable future, I don't think that's going to be realistic. So instead, how do we have these vaguely dueling systems work with each other? How do we get on the same page around goals? How do we get on the same page around acronyms and make sure we're using the same language to talk about these things? And what is success? We need a shared definition of success that is free of ego and free of political interference is the word I was looking for. There we go. Um, Additionally, the Housing and Homelessness Committee has been arguably, I would say we are critical and we are focusing heavily on Mayor Wilson's plan to end unsheltered homelessness. This is a campaign promise that he ran on. This was the plan, that his goal was to stand up enough overnight shelter beds to end unsheltered homelessness. I have a lot of professional concerns about this plan, but it is the plan that we are operating under. And the mayor has set an ambitious goal of ending unsheltered homelessness by December 1st. The Homelessness and Housing Committee is laser focused on how is he getting to that goal and what happens on December 2nd. And this conversation is vital to what happens on December 2nd. So I'm going to stop there. Again, I'm Jamie Dunphy. I'm a city councilor. I'm excited to have your questions and I'm honored to be on this panel. Thanks for letting me substitute. I'm a poor substitute for Councilor Avalos, but I appreciate you all being here tonight.
Thanks, Jamie, and you were a great substitute. We really appreciate your being here. I want to thank you for those candid and informative comments too. And I want to repeat that we are asking you if you have questions for the panelists to post them in the chat anytime during the program. We will be reading those out and answering them as time allows after all four of the panelists have spoken. So thank you. And I want to now turn this over to Anna Plum to talk with us about the county and how it delivers its homeless services.
Good evening, everyone. My name is Anna Plum, and I'm the interim director for the Multnomah County Homeless Services Department. I'm going to start by giving an overview of sort of what the county does as it relates to homelessness and behavioral health. If I have time, I'll dive into some of the sort of topics that Councillor Dunphy spoke to as well, because I have lots to say about those as well, and I imagine we'll get into that in the questions. So Multnomah County's Homeless Services Department, to Councillor Dunphy's point, the county is a human service provider as bulk of what we do at Multnomah County. And the Homeless Services Department is the primary funder of homeless services across the entirety of Multnomah County. We do not do direct service. Instead, we contract with about 80 different local nonprofit providers who deliver services in the community, including the peer company. We contract with them to provide services. I will dive into what our services are in just a minute, but we do an array of services. We also are the administrator of all federal funding that comes into the community to fund homeless services. The Housing and Urban Development funds sends us they have in the past sent us about $35 million to support nonprofit providers reducing homelessness in the region, and that we help nonprofit providers organize and apply for that funding, and it passes through our organization. We are also the local agency that manages data on homeless services. If you access a publicly funded homeless service in the county, we are collecting data on folks who are accessing those services, and we have a lot of really exciting things we're doing with that data that I hope to get to in a minute. I do want to note that everything that we do at Multnomah County Homeless Services Department is underpinned by our commitment to racial equity and our commitment to reducing disparities on who's experiencing homelessness. We know that people of color and other marginalized groups are experiencing homelessness at higher rates than you might expect, given who we have in our community. And our services are designed to reduce those disparities, to make sure that we are leading with equity and helping people end their homelessness across the spectrum of everyone who lives in this community. I do want to give a little history of how we got to where we are. And you've heard some folks say the Joint Office of Homeless Services. That is no longer our name. Prior to 2016, it is actually the case that the city of Portland, under the Portland Housing Bureau, they provided adult homeless services. So the Portland Housing Bureau had a focus on housing, and it also did adult homeless services. And Multnomah County provided services to folks experiencing homelessness who were in a family, who were an unaccompanied youth, or a survivor of domestic and sexual violence. And that honestly didn't work very well because folks don't stay in one of those groups, right? Youth become adults. Families sometimes don't always stay together. And so we had providers who were juggling contracts with two jurisdictions. If you served both youth and families, for example, you would have two separate contracts with two separate entities. And it was duplicative and it was confusing and it just didn't work that well. So in 2016, after a lot of very hard work, the Joint Office of Homeless Services was formed to consolidate and unify homeless services under one umbrella. And that became the Joint Office of Homeless Services, which was housed in Multnomah County. In 2021, that office expanded significantly and became an actual department of Multnomah County. And that expansion was primarily due to the implementation of the Supportive Housing Services Measure, which is a tax passed by Metro voters in 2020, which has added significant resources to our community to help us combat homelessness. So that's sort of how we came to be and what we do now. I do want to also note, and I'll talk about this a little bit more at the end, Councillor Dunphy talked about what are our goals, what's our organizing principle. In 2024, the city and the county worked together to adopt a homelessness response action plan. And that is a plan that is meant to bring together everyone across the county to work together to reduce homelessness, to create new accountability structures, new goals, new outcomes that we can all focus on as a region. So one of the goals of the Homeless Services Department is to support the implementation of that plan. And I work very closely with lots of partners in that particular work. In 2025, we changed our name to the Multnomah County Homeless Services Department. Nothing about our funding structure or our coordination with the city, none of that changed. It was a name change only, but we are now the Multnomah County Homeless Services Department. So what do? We fund a variety of services to help reduce homelessness in the community. That includes housing programs for folks to exit homelessness, street outreach programs that help us meet people who are outside, develop that relationship and help them get there somewhere safe, and also access the services that will help them to do stability. And we also fund over 2,000 24-hour shelter beds across the community. Our housing programs work to end people's homelessness long term. Every year, more than 4,000 people leave homelessness for housing with the help of our programs. We have two primary housing models that we use. If you read the news a lot, you may have heard about these. The first one is called rapid rehousing, and that's a shorter term housing program where a family or an individual can access up to 2 years of housing support. That includes rent assistance and a sort of a light touch case management to help folks access housing and then stabilize in that housing, and then eventually be able to, in that 2-year period, ramp off of that service and maintain that housing on their own. We do track retention in that program once all of those supports end, and at 2 years, more than 80% of folks are still in that housing 2 years later. We also provide a supportive housing, or you might hear it called permanent supportive housing. This is significantly thanks to the supportive housing service measure. This is a much longer term program. This program is for folks who are what we call chronically homeless. They've been homeless for a very long time, or they've gone in and out of homelessness many, many times. And they or someone in their household have a severe disability. That means they probably would not be able to work and or maintain housing on their own, but for this support. So those programs provide a rental subsidy and really intensive wraparound case management services to help folks be stable in those housing. And those services are really sort of individualized. We work with our providers. Some people might just need someone to stop by and check on them. Some people might need help keep making sure their apartment is clean. They're not getting in trouble with their landlord for the state of the apartment. Some folks might need help getting food, getting to medical appointments. So it's really intensive wraparound services to help folks stay in that housing. As I said, we fund more than 2,000 shelter units across Multnomah County. Together with the city units, there are more than 3,600 shelter units operating 24 hours a day, 7 days a week. And then there's the mayor's overnight shelters on top of that. We do fund a significant amount of the city units as well. Right now, Multnomah County funds the alternative shelter the city runs, the 24/7 pod shelters. Those shelters, the 24/7 shelters that the county runs, are really designed to provide that direct connection to services, including employment supports, healthcare assistance, and we really try to have housing placement support at our shelters as well. We do also fund eviction prevention programs. That is actually run by a different department in the county, but we know that keeping people housed is the most efficient and effective way to reduce homelessness. So Multnomah County does participate in that as well. And funding from the supportive housing services measure does fund eviction prevention. Finally, I mentioned data. We manage all local data around homeless services data. The city, their programs enter into our data system. As I mentioned, if you access publicly funded homeless services, you are entering data into our system. What that helps us do is understand who is homeless. So a major milestone we just had was being able to publish every month updated information on who is experiencing homelessness in our community, who is sheltered, who is unsheltered, and who is entering homelessness and who is exiting. So we're really excited about that data and our ability to understand who is experiencing homelessness in this community. People ask a lot about money, and I've mentioned it a few times. So I will say that the Homeless Services Department brings together resources from multiple funding sources. The county puts general fund into our budget. We do receive city general fund as well. We receive state and federal funding, but the bulk of our funding does come from the supportive housing services measure that was passed in 2020. It's really transformed our work. That measure has allowed us to expand. We've added thousands of supportive housing units. We're housing thousands more people a year because of that measure. So it's a really core, crucial part of our work and our success. I do want to note that this topic is also about behavioral health. I am not a behavioral health expert. We have John Carp Evans here, who knows a lot more than I do, but I do want to acknowledge that Multnomah County is the local mental health authority for Multnomah County. Multnomah County has a health department, and that health department has a behavioral health division. And that behavioral health division is responsible to act as the local mental health authority for all of Multnomah County. That authority is granted by the state, and that includes system oversight and service provision. So that behavioral health division does cover a full continuum of care, including mental health services, addiction and recovery services, and that we do that from the whole range of 24/7 crisis to school-based mental health. We have a behavioral health resource center, which is a part of our homelessness response. So we do a lot in the behavioral health realm. I can speak at a very high level to that, but I just want to make sure that's something I acknowledge because that is part of the topic for tonight. I'm running up on time, but I will say I think this is a really important topic. And to Councillor Dunphy's point, I'm really excited and confident about our ability to start working together as a city and a county to make sure we are providing complementary services that honor the skills and the mandate of each jurisdiction. The city does certain things really well, the county does certain things really well, and I'm really excited for us to work together to make sure that we continue to do our sort of lanes really well and complement each other and partner really deeply to reduce homelessness in the community.
Thanks, Anna. That was very informative and helpful. Appreciate that. And next up is going to be Scott Kerman from Blanchet House. Scott is going to talk to us about how unhoused individuals navigate the current system and how the city and county could be more effective. Scott, the floor is yours.
Thank you, Barbara, and I want to thank the League of Women Voters of Portland for inviting me here today. I'm very excited to be on this panel to talk about this with Councillor Dunphy, Anna, and John as well. Blanchet House and Farm, we've been in existence for 73 years. We have quite a history and legacy in the Portland community. I think most people know us for our meal service. There's an image of the cafe where we serve our meals 3 times a day, 6 days a week, breakfast, lunch, and dinner. You can tell that I'm not actually in the cafe because there's sunshine outside of the windows and it's night. And also was rainy today, so there you go. But you can get the sense it's a beautiful space. It's a large space with large windows, a lot of natural light. It's a place of dignity. We serve our meals almost restaurant style, 4 top tables. People who come in for a meal, anybody is welcome, are escorted to a table by a volunteer who puts a plate of food in front of them, and volunteers roam the cafe serving beverages, bussing tables. It's a house of hospitality, so the people who come in for our meals are our guests. To give you a sense of our service level, in October, so the month that just ended, we served over 36,000 hot meals in that cafe. We have to go back to July of 2020. So really at the height of the early pandemic to see numbers that large. We will likely end the year serving 400,000 hot meals in that cafe. That's an extraordinary number. And that does not include the meals that we serve to the residents. Because above this cafe, we have 3 floors of transitional residential housing for men. It is a long-term program, so 9 months to 18 months, depending on how many phases of the program that they stay in. And it's designed to help men get back on their feet. So the first 90 days that they're with us, they're actually performing service in our kitchen, in our cafe, helping us serve meals. After that 90 days, they can get a job in the community, they can go to school, they can do training. Everything that we do is for free. We provide everything that we need. Another part of our program is Blanchet Farm. So that's out in Yamhill County. We've had the farm property since 1962. So not quite as long as we've been in Old Town, but a very long time. It's a working farm. We have more than 60 acres, and we're running a transitional recovery program for men with addiction. It's a very unique program. There's only a handful of programs like this in the country. And I believe we're one of 2 programs that is absolutely free of charge without even the need to bill insurance. And what the people do on that farm, and they're all struggling with addiction, is take care of our animals who are there for therapeutic reasons only to be cared for. We don't slaughter the animals that our residents are caring for. That wouldn't be trauma informed. We have a beekeeping program, a wood shop. We're building out a welding shop. Really a fantastic program. I urge you to go to our website at blanchethouse.org, learn about our services in Old Town as well as Blanchet Farm. And then coming in late January, we hope, will be Bethany's Room, our first overnight emergency shelter for women and for those who identify female. We are not strictly part of the mayor's shelter plan. This was a project that we actually started to work on before the election, so we did not know who was going to be elected mayor. But we are a 100% independently funded organization. We do not receive any public funding. It means we have to raise a lot of money, and that's a lot of work, of course. But we're fortunate to have a very generous and supportive community behind us. So we're funding this shelter ourselves. And we're really compelled to do it because we experienced too much death and violence in the community of women that we serve. And when we started this program, this is before the Wilson administration, there were no overnight emergency shelters for women to go to at all. And the shelter is named after one of our longtime meal guests, Bethany, who just over a year ago was tragically killed by a car about 2 in the morning over by Burnside and Ankeny Alley. And as a team, we just said enough. And so we're doing this project to save lives and to save women from the horrors and the violence of the street. And if that's all we achieve is providing safety and a chance to sleep for 75 women a night, then it's going to be worth every dollar that we invest into this project. But we know we're going to do more than that because we're going to work closely with provider partners such as Rosehaven, Day Center for Women, Transition Project, Central City Concern, our Bybee Lakes, DV, our domestic violence shelter and sexual violence programs. If these women can actually sleep at night, if they don't have to suffer from the extraordinary sleep deprivation that occurs because they're afraid to close their eyes at night because they'll get attacked, we can only imagine what progress our provider partners, as well as our own team and team of peers at Blanchet House, will be able to do for these individuals. We have to think to yourself about how you feel after a few lousy nights of sleep, what you're capable of doing either at home or at school or at work, what is reasonable to expect folks to do during the day if they have spent sleepless nights in terror and violence. And so what we're about is promoting hope and alleviating suffering. We certainly, even though we don't receive any funding from the county or the city, we're certainly part of the ecosystem. And we are colleagues with a lot of providers who do receive funding, particularly from Multnomah County. And their strength is our strength. And when they're challenged, either by funding or other circumstances, well, those challenges then redound to us and they redound to the community we serve. So I've been in this work 6 years. I've frankly been trying to untangle the city and the county. When I started this work, there were different people in charge. So there was a different chair and a different mayor. And I was sort of new to the whole system. And as I was trying to figure it out and kind of ping-ponging back and forth, I think I said in an interview once that I felt very much like my 13-year-old self with my divorced parents. And I think Councilor Dunphy sort of said it, it's not a great answer when, the city is pointing to the county or the county is pointing to the city. But every time I went to the city to get an answer to the question, they sort of tossed me back to the county, and then I'd go to the county and they tossed me back to the city. And you just realized there was no way to move forward. And so there was a lot of hope with Chair Vega Peterson and with Mayor Wilson, sort of a renewed sense of the city and the county collaborating together, because frankly, they are two massive centers of gravity in our metro area. And if they can't coexist and collaborate, then we're really not going to get very far. And I'm certain everybody on the panel would agree with that. So I think, as Councilor Dunphy said before, it's not always pretty. It's messy in a lot of ways. It's politics, it's business, it's charity. There's a lot of interests and stakeholders who are all looking for answers. And I think I certainly want to applaud our elected officials and our public staff and our public servants, because they are working hard and often in trying to solve very complex challenges and problems that are decades in the making. And so I think one of the messages, I'll end with this and give John a chance because he's been patiently waiting for all three of us to finish our intros. That these are very entrenched challenges. We're talking about poverty at the root of everything, which is not a topic that we handle very well in this country. Frankly, we're not comfortable talking about it. But we're talking about people experiencing profound poverty, often generational, often community-wide and systemic. And the progress is not always going to be linear, and it's certainly not going to be quick. And I don't want to spoil everything for people tonight, but there are no quick fixes. And so I don't think any one of us are going to reveal Dumbo's magic feather that is going to get us out of this situation. But that does not mean that we're not making progress or invested in making progress. So I look forward to talking about these subjects and listening to my colleagues on the panel tonight.
Oh, Scott, thank you so much for that encouraging as well as informative set of remarks you just made. And now I'm going to turn it over to John and see what he can tell us about behavioral health issues as he sees them and how individuals in his world navigate the system.
Thank you. I appreciate it. Good evening. I'm excited to be here. My name is John Carp Evans. I'm the Deputy Director of the Peer Company, formerly Mental Health and Addiction Association of Oregon, or MHAAO, or however that came out of your mouth when that was formerly our name. Real quick, I just want to set the ground for what the Peer Company is, who we serve, what peer support is, to really get a sense of how we support the behavioral health community. At the Peer Company, we're inclusive-based, community-based nonprofit. We promote self-directed recovery and wellness, honoring the voice of lived experience. And really what that means is that our staff, our people that have been there, we have lived experience with substance use, mental health challenges, houselessness, criminal justice system. And really over 90% of the people we employ, including myself, all have lived experience in one or multiple of those fields. We're a little different than Scott's org. We get funding from all sorts of places, from the county, from the city, multiple counties, from the city, from the state, our local healthcare systems, private companies, and also a donor base. So really a braided funding stream. The federal level, it comes from all sorts of different places. So we have the luxury of working hand in hand with a lot of different government systems and a lot of local systems. In our organization, we have over 40 unique programs that have peers based in all sorts of different areas in our community, from our court systems and jails. The Behavioral Health Resource Center was mentioned, a large day center in downtown. We have street-based outreach. Also, we have Optic, which is our training hub. So we are one of the largest trainers in the state that help individuals that are seeking to enter this field get certified as peer support specialists. And we have a large conference called Peerpocalypse. Check it out on our website. We host it every year in Seaside. 1,000 people in person attend for the 4-day conference, and another 300 to 400 virtually. So those are really the three arms of our organization. And I also wanted to touch on what is peer support, just to get a sense of, we really are a non-clinical org that doesn't do clinical work, but supports the behavioral health community. Peer support is a person-to-person approach to recovery where real people use their experience to guide and empower others at the start of their journey. It's about meeting people where they're at, building trust and connection, and that make it easier to face the challenges of recovery. Our peer support specialists are advocates for peers and can help them access services and resources they are seeking. And lastly, I want to talk about one of the programs we have that's called Police Provider Joint Connection Program, or PPJC. We like acronyms, but really it's a collaboration. And for myself, it's the first program I've worked on that's been funded by the city, county, and state. So we have each entity paying 33% essentially of this program. And what we've done is we've had the luxury of bringing multiple different providers together and doing coordinated outreach, really with our service providers, from treatment providers to outreach teams to housing teams to behavioral health teams, city and county oversight from their funding, and really figure out how, if we collaborate and how we work together. And I'm excited to be on the panel with the other folks, and it's been brought up multiple ways. If we keep collaborating and keep working together, how do we untangle this in the most effective way possible? When we look at some of these challenges, in my opinion, there's a lot of foundational growth. Overnight, this isn't going to be solved. We're not going to build a mansion on sand that's going to fix all these problems. But if we invest in the foundation and slowly build up, we'll be able to see some growth. For our PPJC program, I wanted to run through some data real quick. From January to September, so just this year, we've had 2,344 encounters in that program. Out of those, over half are interested in services that day. And out of that, we've connected 95 people to same-day detox or substance use services. So really, when we work together, we're seeing an immediate impact. That we've had over 70 community partners participate in that program. Too many to name all of them, but Portland Police, Portland Street Response, the county, the city, Clean and Safe, all our local detox providers, many of our local outpatient providers, our shelter providers. And so really we've had the luxury of bringing community together, doing this focused outreach, seeing how collectively we can work better together than independently. And what's really been amazing about it is we do this twice a month, but every day in between, these partners are talking, right? We're building relationships, we're connecting service providers with other service providers. And I would never say there's not competition for funding, right? I think that's an obvious thing. But what we've learned when we're sharing resources and really helping individuals access care through the right door, we've seen numbers increase because we can target and support individuals appropriate for the correct service versus trying to keep individuals connected to our care because we want numbers and we want to hoard resources. So the last thing I'll say is that as we have this conversation tonight, I really hope that we can discuss as a community how when we work together through city, through county, through state, through federal level, and providers, how we can be more effective at supporting our community.
Great. Thank you, John. And thanks for those very valuable insights. So before we turn this over to audience questions, and let me remind those of you in the audience that you could still post questions in the chat, and we'll get to them as we can and raise them with the appropriate panelists. But let me ask first of all the panelists, are there any brief clarifications or final points any of you would like to make before we jump into those questions? Okay, good to go then. Let's see. We have, let's do the first question for Anna. This one is about accountability measures. The need for accountability measures has been an ongoing concern, as I'm sure you know, in homelessness and behavioral health services. How does the county measure effectiveness and ensure accountability in those areas?
A great question. So as I mentioned, we do not do direct service ourselves. We contract out with nonprofit providers. There's about 80 of them that we work with. And we provide accountability via contract monitoring, which includes spending and outcomes. So if we contract with a certain organization, we are saying, we are going to give you this amount of money to do this work. And here's the outcomes that we expect to see from that work. So if it's someone who we are hoping to do outreach that leads to housing placement, we might say, we would like to make sure you're connecting with at least 150 people. That's a very low number. And we would like you to, we're funding you to place 30 people into housing over the next year. So all of our contracts are designed that way. And we are updating how we monitor for those outcomes. So what currently happens, and we're moving towards another model, is we are looking at those outcomes on a quarterly basis. So all providers send us quarterly reports that essentially say, here was my target, and here's what I have done so far on all the outcomes that you have contracted me to achieve. If there is a situation where somebody is far under their outcomes, we would start having a conversation with them, or like, hey, like, what's happening here? Is there a reason why you're not hitting your housing placement goals? Do you need more support, or do we need to think about something else? Sometimes it'll be something like, well, we've had a hard time hiring up for the person who's going to do that housing placement, but we think we can get this done. Here's how you can support us in that. As of right now, those have been quarterly reports that are submitted sort of like a Word doc that comes back to us. However, our providers are also entering all this data into our homelessness management information system, the data system that I referred to earlier. So we can also pull there. So every year, we're also looking to see if what they're reporting also matches what they're putting in our database. We are very, very close to a new monitoring dashboard that will enable us to see all that and much more closer to real time. So we'll be able to look at what are the outcomes of these people we put in their contract, and then what are they actually doing? And we can monitor that sort of automatically using our data systems on a regular basis. So that's going to be live in the next several months. So we're really excited about that. That'll make that work that we're already doing just that much more streamlined and that much more quick. So that's the primary way that we hold our contractors accountable.
Good, great, thank you. Next question for Jamie, and this is a two-parter. Jamie, you mentioned the charge given to city agencies to review their plans on homelessness. When are the results expected to come before the Housing Committee? And second part, what have been the conversations about bringing the city's goals and the county's goals into supportive alignment?
Good question. Yeah. So our Unified Housing Strategy report is due to the Housing and Homelessness Committee on December 2nd. That is an intentionally targeted date because it is the day after the mayor's plan for ending unsheltered homelessness. Um, that is the day we start the conversation about what comes next. And that's not even accurate. That is the day we start then what comes next. The conversations about what comes next are already happening. But that report will be coming to the Homelessness and Housing Committee on December 2nd. We will be holding a hearing about it, and we will be talking about what the findings are, where those gaps are, and start being intense about uh, developing the policies that are needed, that are missing, and clarifying the policies that are overlapping. So more to come on that. What was the second part of the question? I'm sorry.
Oh, yeah, the conversations about bringing city and county
Yeah.
goals into supportive alignment.
Yeah,
Thank
Anna started to talk about the what we call the HRAP, the Homelessness Response Action Plan. There's so many acronyms in this work, y'all. I will screw it up some of them, but
That's
um,
it.
all right, yeah. The Homelessness Response Action Plan, the HRAP, is a as Anna mentioned, there was a previous iteration of it that has already been approved and is moving forward. And we are moving towards the new set of goals that will be shared between the county and the city. Um, right now, how we are working on trying to align that is something that the previous city council didn't do a great job of, is we're holding regular joint county city sessions where we are hearing the report from the Department of Homeless Services about what they've done over the last quarter, what has happened, and all 12 city councilors and the mayor, and then all 5 county commissioners sit in Portland City chambers, city council chambers, and get a full report about it. And I imagine Anna's been involved in that. I imagine it's pretty uncomfortable to sit in front of 18 elected officials and get grilled. Um, but it is about what was the goal and what was the response and what have we been able to accomplish. The new set of goals, as I understand it, are I think going to have are going to be reflective of the evolution that has been happening between the county and the city, in that we are getting to a point where we can have KPIs, as it's called, key performance indicators. We are having a place where we can get to um, uh, broader goals that have tangible outcomes. And we haven't put specific numbers on those goals yet, but we've outlined what those what are the questions that we need to be asking? What are the areas that we need to measure? We have a pretty good sense of that, but we don't have specific goals for the next set. For example, how many housing units are we going to build? How many shelter units? How many people are we going to serve in what way? And that has a lot to do with the uncertainty of what we're facing right now. We have a lot of resources in this community, and they are becoming more and more aligned every day. The Anna also mentioned the data sharing that is going on between the city and the county. We also have a single list, a by name list that has every person who has received any form of services through either staying in a shelter overnight, coming to either overnight or 24-hour shelter or transitional housing, including some of the services that we have, some of the day centers, things like that. Um, we have better information. We have better systems in place right now than we ever have. And we have two elected bodies that are laser focused on getting tangible results. And we're actually in a place where we can have those results. We weren't even in a spot where we could have those questions before. So I'm feeling very optimistic about what comes next. But the enormity of the challenge before us is needs to be reiterated repeatedly. This by name list changes the game for how we deliver services across governments and to some of the hardest to serve populations in the county. But it is worth noting that there are almost 15,000 names on that list. Now, that doesn't mean there's 15,000 people sleeping in a tent on a sidewalk today. But that is 15,000 people in our community who are receiving some form of homeless services. That can include people who are couch surfing. Can include people who are in some of our shelters. It can also include the people who are receiving rent assistance right now from the county. Um, it's an enormously valuable piece of information, but the scale is just astonishing. Um, and perhaps uh, Anna can correct me with this, but I believe right now this new system is responding in ways that we haven't experienced. We're getting about 1,000 people off the street and into housing every month, which is amazing. But we're also seeing about 1,400 people fall into homelessness every month by no fault of our own. Prevention is what is an ounce of prevention is worth a pound of cure. I fully believe that. trying to prevent people from falling into homelessness is a huge focus, but we have an enormous crisis on the streets right now. And so this by name list uh, is an enormous tool. This new set of uh, HRAP goals that we're going to have is a huge step in the right direction. And the seriousness of our two elected bodies collaborating, sitting next to each other, working very closely on these things, not at odds against each other, is really going to change the difference. I honestly think some of the challenges we faced previously were less systematic and more personality clashes. I think that, candidly, I think that the the previous county chair and the previous city mayor had very different definitions of what success looks like, different approaches to the work, and they just each went their own way in a lot of ways. I feel a great sense of alignment, and I think that things are coming to a place where it's actually defensible, and we can actually target those responses. Because, as everyone knows, we call it homelessness, but it's deeply unfair to call it one thing when it's really six or seven different things that just the only commonality is a person doesn't have a home of their own. We're now at a place where a system can actually respond to that in meaningful ways, but that please don't, don't let my optimism also overshadow the enormity of the case before us.
Thank you. So Scott, here's one for you. What are your ideas about what the city, county, and metro can do to increase the availability of affordable housing for individuals and families in our region? And along with that, how do you get neighbor buy-in for that kind of housing?
Well, thank you for that question, and I don't know if I have the expertise to satisfy um, that question. I think to set the stage, we are woefully behind in terms of housing units in the metro area, really throughout the state of Oregon. Another crisis that has been decades in the making. Both slow development of housing matched with explosive population growth over a decade or so when Portland was, the hottest ticket in the country and everybody was coming here. There was a time I used to work in education, and there wasn't a resume I didn't receive from around the country. They all started, the cover letter started, my partner and I are thinking about moving to Portland. But they had no basis for being here, no family, no friends, no history. Everybody was coming to Portland, and frankly, we just didn't keep up with the range of housing, affordable at different levels, starter homes, the density of housing, and that is not going to be easy to catch up because it's expensive, and it just takes time. And so I think, as the mayor has said with regards to unsheltered homelessness, we're not going to arrest our way out of this situation, which I applaud the mayor for saying that. We're not necessarily going to build our way out of it. I think we're going to have to be creative about what housing looks like, what it looks like for a new generation of people who want to be able to afford a place to rent, who afford a place to own. And it may not look like, the McMansions and the single family dwellings that have characterized, I think, our housing stock for decades and decades and decades. Apart from that, I think one of the things that we really have to signal in this conversation is when we're talking about our houseless and our housing insecure communities, it is not a monolith. There's seniors, which is our fastest growing segment of houseless and housing insecure individuals. There are youth, there are families, but also a large segment with very high acuity, that is very high levels of illness, opioid use disorder, substance use disorder, and psychosis, which can manifest as mania, it can manifest as schizophrenia, it can sometimes be substance induced. A new strain of methamphetamine that we refer to as P2P or super meth, which is having profound psychotic effects on individuals. These are not necessarily people who are going to be able to survive in independent housing. They're certainly going to make, and I'm sure John can speak to this, they're going to need an intensive level of support, and perhaps for a very long time. So I suppose a poor answer to the question is we need to build housing and different kinds of housing and density of housing throughout the metro area in all neighborhoods. I think there's certainly a lot of conversations that I can't speak to at the state level with regards to land use and land use restrictions and urban growth boundaries. And I'm going to stop there because that's about as far as I can get without really demonstrating that I don't know what I'm talking about.
Good job with that, though. Um, John, just following up on what Scott was just saying, what is the state of mental health services in Oregon, such as inpatient care, for example?
Yeah, I would believe, I believe we could say if we look at residential substance use treatment, mental health treatment, housing, if we look at the infrastructure, we're so far behind. And Scott really hit the nail on the head about, we're lacking in so many services. I have this discussion with people every day. It feels like maybe more than every day. But they're not going to show up overnight. We're not going to build treatment centers. We're not going to build residential mental health centers. We're not going to build enough housing overnight to meet the need. And when you're in it every day, I believe part of it's easy to see. When you're not, I can understand some of the challenge. And I have this conversation with folks, and I like to talk about the infrastructure of our freeway system. I was in a different state and I was on a 6-lane freeway, and I was like, man, this is amazing. And I came back here to 2 and 3-lane freeways, and that's not going to turn into a 6-lane freeway overnight. To get the freeway up to speed to meet the population demand, it's going to take planning, it's going to take time, it's going to take this huge infrastructure build. When we look at the challenge with clinical services and housing in our community, it mirrors that identically. We're way behind the game. We don't have the infrastructure. We haven't grown as population has grown. And overnight, it's not going to get there. It's going to take time and serious planning to build at the right level and build the right services. I think, when Jamie talks about the plan and really being strategic about it, yes, it's another plan, but if you ask everyone on this call, we'd probably say we need to start at a different spot. And so without strategically looking at where is the need most, how do we strategically build out the goal as a community, we're going to build the inaccurate or inappropriate service depending on who's in charge of designing that build. And so I would say we're way behind the ball. The infrastructure is not there. It's going to take time to get there. But I believe the more we communicate and work together like this, we'll start to take the appropriate steps to get that infrastructure at the level it needs to be.
Okay, thank you. Anna, back to you. You mentioned the tracking of who the homeless are. Can you share who the people are, long-term versus short-term, mental illness, drug use, just don't want to be helped, etc.? And are veterans a large portion of the homeless?
Hey, yeah. So I wish I could put the information out. So yes, we do know a lot about folks. I can tell you actually, unfortunately, the number that the counselor quoted was low. In August, which is our most recent month, because there's a delay, we knew there were 16,000 people experiencing homelessness in Multnomah County. And we know sort of their ages, we know their race. We do also, I'm just checking and looking at that to see if we have veteran status on there as well. So we are aware. Right now we have 6% of the folks who are experiencing homelessness in August were veterans. So I'm just quickly glancing at our data dashboard to see that particular piece of information. What we don't have as well in our data is something you asked about, like people's mental health status, their sort of addiction status. That's because this is where we enter information on services they're accessing, but we don't have diagnostic information in our homelessness information system. We might know if someone is enrolled in a recovery program that we fund, for example, but we wouldn't necessarily know what their diagnosis is. We do know how many people are chronically homeless. Those are folks who have been homeless for over 3 years or episodically homeless, and it is a significant number. It's about half of the folks that we see in our community are experiencing chronic homelessness. We are making strides in getting a better sense of the mental health and sort of recovery needs, medical needs of our population. So something that we're really excited about is we just finally were able to get a pretty intensive data sharing agreement with HealthShare, which is a major healthcare provider in the community, where we were able to combine our homelessness information with information from people's healthcare data, so we can get a sense of folks who are experiencing homelessness, how many are what we would call high acuity, who have a substance use disorder or severe and persistent mental illness, and that helps us get a sense of what is the size of those different populations and how can we design programs to meet those very specific needs. But to John's point, getting that all put together is going to be a major challenge. One thing I wanted to respond to that's somewhat related is one of the reasons I'm excited about the homelessness response action plan is that it's not just a plan for the city and the county. It's a plan for health share. It's a plan for hospitals. It's the goal of that plan is to acknowledge that the entire community has something to do to help reduce homelessness. And we can't do it as public jurisdictions alone. We need our behavioral health partners, our hospital partners, our healthcare partners. We need them to come to the table and problem solve with us. And quite frankly, bring resources to the table so that we can do this together. So I think that's a really exciting part of the plan. It's not just city county collaboration. It's all of us collaborating together. And we're working to set those goals in a way that reflect that we all have work to do.
Thank you. So Jamie, you had wanted to jump in a minute ago around the question about providing more housing and so on. But I have a maybe, I don't know if this is a related question or not, but maybe you can do them both. And the question is about tent removal. And I think the concern is about sort of the safety and long-term impact of those that are affected. How do we do this in a humane way so they're not just thrown out on the street? Can we provide lockers for people to keep their belongings in? Kind of where does your committee stand on that? And then if you wanted to add to the conversation about providing more housing, go for it.
Great. Well, I just want to, I will very quickly just have an aside, building off what Scott was saying. We have been building not enough we've not been building enough housing, but we've also been building the wrong kind of housing. Not only in the work that the government has been doing to build affordable housing, but also the market has been building incorrectly. In 2019, the Housing Bureau came to the city of Portland and said that there were 4,000 people sleeping on the streets and that there were 4,500 empty housing units in the city of Portland that night. The problem was the majority of those empty units were the luxury end of the spectrum. A lot of those big towers in South Waterfront you see. But the thing that is honestly the most horrifying to me is that the city has spent hundreds of millions of dollars on building a permanently affordable housing. But it has been built at 60% of AMI, area median income, meaning that if you take the average of all the salaries that people earn in the city and you build it for people who earn 60% of that, but the real need is 0 to 30% of that. And the problem right now is that 60% AMI apartments rent for about $150 more or less than a apartment in East Portland. So if you were an individual of low income and you had to jump through all the hoops to qualify for affordable housing, verify your income, follow a lot of the rules, or you could pay about $150 more and you could live in Powellhurst or Lents or Gateway, you're almost certainly going to do that. I don't know if this is the accurate numbers, but in August, late August, I was told that there were 1,750 empty, permanently affordable housing units in the city of Portland. Units that could not find a tenant. And it is putting such a financial strain on the nonprofits that run these units that they are now facing a crisis of their own. This is an enormous failure of leadership of the previous city council, and to the mayor's credit, he has a task force that is actively trying to figure out how to get tenants into those units and how to buy the rents down so that we can get the people who need housing the most into the most available housing. To the question of tent removal. There was an article in the newspaper Street Roots very recently that showed that the city of Portland does the most campsite cleanups and the most tent removals of any city in the United States, and that it is directly leading to a disproportionate amount of death on our streets. The way that we removed 8,000 campsites last month. What the data shows us is that when people are swept, when the campsite is moved, when we break up these ad hoc communities that have evolved out of folks who are living on the streets, we leave people enormously vulnerable. Not only do we sometimes remove their IDs, their money, or their medicine, but we're also removing the community that would come in and check on them and say, hey, I haven't heard from Johnny in a while. What's going on? And go open his tent. And people are overdosing and people are dying. And there's nobody to go help them and make sure that they are surviving till morning. I think everybody on this call will agree that a tent on a sidewalk is not a humane place for any of our neighbors to ever sleep. That is not something that in the year 2025 we should accept as being a thing that we allow our neighbors to do. The mayor agrees, and that his thought specifically was that we should focus, instead of allowing public camping, which has a whole host of other problems, that he should focus on a place for people to stay overnight. Overnight shelters were a missing component of our continuum of care. But a person in a shelter bed is still homeless. And a person who is forced to leave all of their belongings or their families or their pets behind is going to have a significantly worse experience trying to navigate services and figure out what comes next. If we don't allow people to, when we do not allow people to bring in the few belongings that they have, maybe a bag or two, and so as the person was questioning, day storage and overnight storage is an enormous challenge. There is a significant amount of effort that is going into building out that capacity, but it's not nearly sufficient. And the challenge of siting these locations, of putting a homeless shelter, an overnight shelter near a day center, near storage, sometimes those things are actually miles apart just because we can't find the right places to store them. And so it creates an enormous burden on the people who are on the streets. I would say a shelter bed is better than a tent in most circumstances, especially as the weather changes. But we all know that a person sleeping in a tent is not actually is creating challenges for themselves to be able to be successful and challenges for the rest of the community to be able to thrive. So we have to move towards what that next step is. It cannot just be a shelter bed on the floor, of a warehouse. That's, a cot on, or a mat on the floor. That is not enough. We have to be intense about what comes next. When those folks are asked to leave in the morning, they should be met by a social worker right there. It says, hey, where are you going today? And what do you need in order to figure out what comes next? Do you need access to healthcare? Do you need access to addiction treatment? Do you need job training? Do you need housing? How do we get you on the list? How do we get you ready for what that next step is? I think that the tent removal process, the lack of continuity between moving from shelter into housing into permanent housing, is such a disparate system, that siting problem, all those things, we're creating distrust among the people who we need to serve. We are showing to people that we are actually not trying to meet their needs and help them, but sometimes we're trying to make the streets look cleaner. Sometimes we're trying to check a box and show that we're doing enough, but it doesn't actually help people navigate those services. And if you are sleep deprived, if you are having challenges with mental health, if you are having challenges with drug addiction, it's going to be an almost impossible task to navigate those services on your own, especially starting at 6 in the morning when we are now kicking people out of these overnight shelters and out into the sidewalks. So I agree, though, that we should not accept as a community that a tent is an acceptable place for any of our neighbors to sleep. It's not safe. It's not safe for the people who are experiencing the levels of violence, especially women on the streets, the levels of truly inhumane conditions that some folks are living in is heartbreaking. So we need to do better, and this system needs to inform itself better at every step. I may have missed some parts of the question, but that's a good enough answer for now.
No, I think you did a good job. So Scott, back to you. There's been an ongoing debate among those who advocate for housing first and those who argue for focusing first on treatment and social services. In your experience, which is most needed by the people you deal with on a daily basis?
Well, that's a really good question, and it's a very complicated question, but I'm going to try to answer it without a lot of complexity. Just to set the background, Housing First is an evidence-based permanent housing strategy that demonstrates that putting people into permanent housing that has robust supports attached to it is the most successful kind of housing that we can provide for people. Unfortunately, what we have mostly experienced here in the metro area is not necessarily a pure housing first approach, because we don't have the robust behavioral health and substance use infrastructure that is really a central component to housing first. And that's because of really 30 years of disinvestment in behavioral health in this state that Governor Kotek is starting to change. We're starting to see some investment. But bear in mind, for the state hospital, there are no beds available for civil commitment. Every bed in the state hospital is being used for a forensic hold. That is for an individual in the judicial system. So we're sort of we need to invest in having more beds and more opportunity for the kind of care that people frankly need but cannot get in Oregon, and that's gonna take time. So the debate around housing first often gets very contentious. It's a debate in many ways about ideas, about what we know, works best. But unfortunately, we don't necessarily have the framework for that to be as successful as it should be. We're in the business of transitional housing at Blanchet House, and now we're opening an overnight emergency shelter. And so we understand the benefit of transitional and bridge housing. People, frankly, sometimes just need time. Even for the men who graduate from our housing program, still have a lot of difficulty being successful in independent housing because, frankly, they don't necessarily have all of the adulting skills that is required to sort of be successful on your own. And that's because there are gaps in their life. Or maybe they didn't grow up in a functional home and don't have a lot of experience on which, to manage a budget and to pay a utility bill and to figure out how to get your sink fixed. And then there's a tremendous amount of isolation for people who go into independent housing, but feel very separated from their communities. And so it sounds great in the ideal, in the abstract, but it doesn't always work that way when you start plugging, human beings into the matrix. And so we need all kinds of housing for this to work. I will say for Bethany's room, for the overnight shelter that we're going to run, we are going to be able to provide storage. So we bought our own property. We've already invested nearly $3 million in this project, and we haven't even opened the doors yet. But we purchased a property. We're renovating it to make sure that it's a trauma-informed space. We're getting twin beds and mattresses donated by Mattress Firm, courtesy of the National Women's Shelter Network. And so it will be congregate housing, congregate shelter, but I think we're trying to make it as dignified and trauma informed as we can in that space. We're going to have lots of storage in this facility, and so the women will actually be able to leave their belongings if they would like during the day. We're timing our shelter to end at 8 a.m. That blew up my budget because it blew up our staffing model. And honestly, the answer to a lot of the questions in this forum tonight is money, because it all costs money, and it takes people. These are people delivered services, and people are expensive. We want to pay them a dignified living wage and make sure they have the benefits and the supports and the time off that they need. But by closing the doors at 8 a.m. in the morning, number one, it's gonna be after all the school buses have picked up the school children. So we're not going to be exiting 75 people onto the street when there's, people are trying to get their kids off to school. But it also is going to bridge the time to when Rosehaven opens, which they currently open at 9 a.m. And so that way, women can go straight from Bethany's room to Rosehaven or to other services. But these are all very complex, systems of infrastructure that has a lot of moving pieces. And so, I understand a lot of the reasons why shelters end early is it's frankly, it fits a staffing model. So you're not having to hire extra staff to bridge extra hours, which really increases the budget. And I think to the mayor's credit, he has responded with urgency. I don't really care if the mayor hits his target. Every bed that we're close to that target is a win. I don't want to score this like it's a football game or a baseball game. But I think I was just really grateful to see the mayor and the city council, his team at Portland Solutions, really working with urgency. Because we can talk about these issues to death, but unfortunately, like real death occurs. And if I could have waved a magic wand and opened this shelter overnight, I would have. It just takes time, and it takes a lot of planning and a lot of thought. We have to hire staff and everything. But I think having that sort of continuum of housing. The last thing I'll say is, Blanchet Farm is a marvelous model for how rural properties could be used as places of healing and recovery for people. We focus Blanchet Farm on people struggling with addiction, and that's mostly substance use or alcohol addiction. But it would be a brilliant program for people with mental health challenges, with trauma, with other challenges in their life. I think it's in the Netherlands. They have dementia villages for people with dementia and Alzheimer's. And when I hear about those programs, I'm like, well, that sounds like Blanchet Farm. So, I think we can think creatively in this state about different ways that we can house people and different ways that perhaps we can increase that housing and those services in our rural communities because we focus a lot of our energy and a lot of our money on Portland metro area, but our rural areas in the state are also experiencing these challenges. And if they start to fail in providing these services, that's going to redound to the metro area. So I think at the same time that we're concentrating on improving our systems here in Portland, we also have to keep a view on improvements that we need statewide, because if we're not helping our rural and our coastal communities, we're going to see that traffic come to Portland because that's where the services are going to be concentrated.
Wow, thank you for that. John, we're almost out of time, but I want to give you a chance to maybe answer one more question or add in whatever your suggestions might be for the city and county to deal with behavioral health, mental health, drug addiction type issues, the kinds of things that you're up against every day.
Thanks. Yeah, I'd like to add on to what Scott just said real quick.
Okay,
And
go for it.
he said robust support and multiple times. And I think that, we need a whole continuum. I've worked in permanent supportive housing programs. I've worked in transitional housing programs. I've worked in shelter programs. I haven't seen any of them be successful without the correct support. And so I think, when we're really looking at how do we need this program? Do we need this model? Do we need this? We need models that are true to the model. And if we're building models that aren't true to the evidence-based models, it doesn't matter what model we build because we're going to fall short of our goals every time. I guess in closing, what I would add is that the continued collaboration, calls like this. Scott mentioned Portland Solutions. The chair has been mentioned. The mayor has been mentioned. We have city council present. We have county leadership present. As we continue to address this mountainous challenge, we have to work together. Ego was mentioned multiple times early on. And I think that sometimes that's, we don't say that as much, but that's been a part of this, right? And if we don't look at this from all angles and really figure out how do we use local government, how do we use private, how do we use nonprofit, how do we lean on the faith community, how do we bring the community together as a whole and really work together on one solution, we're going to keep going our own routes and run into these dead ends and then have to circle back to the middle and find the group. So as we continue, and it's not always pretty. There's challenges. We sometimes we go backwards before we go forwards. But as long as we continue to have this shared goal of how do we support individuals in the community we live in our community as a whole, we're going to keep making progress. And the very last thing I would say is that we have to build the foundation and the infrastructure, and that takes time. This is not an overnight solution. This is not a 1 year or 2 year solution. This is a long-term solution that we're going to keep seeing little milestones. We're going to hit milestones. We're going to make success. Every shelter bed added, every person housed, every person that enters in treatment. That's a success for our community. We have to look at those successes and realize that's contributing to our overall goal.
Thank you so much. And thanks all of you. That was a very informative and stimulating and can I say hopeful for me discussion that we've been having. Wish we had another couple of hours to talk. Again, thank you for sharing your time with us and your deep knowledge. And I will now turn the program over to President DeCoursey.
Thank you all so much for what you've shared tonight. Like Barbara, I feel inspired. I feel like a sense of hope about what we can do as a city and our county, just knowing that you all are out there and bringing obvious compassion and empathy for the people who are most impacted by this. So thank you. Thank you for that. I also want to thank our audience for your thoughtful questions. We didn't get to everything. There is no way one panel can address every element of such a complicated topic, but we hope you gained some valuable insights tonight into how the City of Portland and Multnomah County are working together with community organizations to address behavioral health and homelessness. We want to give special thanks to our volunteers for the help in bringing this webinar to you. Our moderator, Barbara Bird, thank you. Our Community Education Chair, Melanie Billings-Yun, and our Behavioral Health Interest Group. Funding for this program is provided by donations to the League of Women Voters of Portland's Education Fund and from the Carol and Vilma Saling Foundation. We also want to thank Metro East for recording this webinar. I would be remiss if I did not let you know that the League of Women Voters of Portland is a membership organization, so you could join the League tonight even. We thank our members for their generous volunteer and financial support for our educational programs, and we welcome you to join our League. Membership and donor information is on our website at lwvpdx.org. Again, please tell your friends, colleagues, and neighbors to watch this video or listen to the podcast of this program when it is posted next week on our website, lwvpdx.org. That's where you can find information about our spring panels when we announce those, election information, and all member resources. I want to thank again our panelists, our listeners, our volunteers. Have a great evening, everyone. Thank you.